Hi there, and welcome to another episode of my autoimmune path. My name is Jen, and today I'm going to be discussing low-dose naltrexone. So what is that? Well, it's a medicine, and it happens to be a medicine that I actually take. And I've mentioned it in one of my previous episodes that was about kind of my medication story and as it related to steroids and being on a lot of steroids through the years, and then, really needing something to be able to transition to that would level out my symptoms and my disease so that I didn't have to keep getting on those type of steroids, because they're pretty hard on your body and have a lot of side effects. Just to give a little bit of information about low-dose naltrexone. There's a medication that is just naltrexone. And I guess as far as the low-dose route. And by the way, this information I pulled from the LDN Research Trust website. Got my notes here. Yes, it's ldnresearchtrust.org, and it's a website that is based in the UK, but it's, I guess, a nonprofit, which is, I guess, why it says .org. Anyway, it's a really good website, and I would encourage you to check it out if you're interested at all in learning more about this. But in 1981, there were a couple of scientists who were, I guess, at Penn State University, and their names were Dr. Patricia McLaughlin and Dr. Ian Zagon, and they used small doses of naltrexone. And I think this was possibly in an animal study. Yeah, I think it was. To inhibit tumor growth in animals. Then later in the mid-80s, in 1985, there was a physician who practiced out of New York City. His name was Dr. Bernard Bahari. And he used the low dose in humans. At first, I think he was working with about 3 milligrams and seeing how that would help patients. Or it may have been, and I've heard, several kind of stories about this whole process, but I think he had patients on the regular naltrexone and was trying to taper them down. And when he got to 3 milligrams, he found some benefit. But then eventually, I guess somehow he landed on like the ideal dose for humans as 4.5 milligrams. And that's actually what I take, is 4.5 milligrams. Anyway, low-dose naltrexone is used pretty much off-label for many different autoimmune conditions. Of course, I have, as I've mentioned, ulcerative colitis, and it can be used for Crohn's disease. It can be used for lupus, multiple sclerosis, many conditions. I think even Sjogren's syndrome, which I've mentioned and that I suspect I might actually have. But so you say, okay, well, how does that work, and what is this? It comes in different formulations, and I didn't actually realize this, but it can actually come like in a cream form that you would put on your skin topically. It comes in troches, which are I don't know a whole lot about them, but it's like this thing that you, I think, put in your mouth, kind of at the back of your mouth, and it kind of slowly dissolves. It can come in eye drops, which that would honestly probably benefit me. And it can come in just, I think, like sublingual drops. But the way that I take it is in a capsule form. And so pretty much any of these formulations would need to be manufactured through a compounding pharmacy. And the way that I first found out about low-dose naltrexone was actually from a Facebook group that I had joined called Hashimoto's 411. And if you don't know what Hashimoto's is, it's a type of thyroid condition that's autoimmune. And my mom had it. And so I've just kind of always been like aware or wanting to make sure that I wasn't heading down that path, right? And so the way that, or what that looked like, is just making sure that I would get my TSH checked, you know, the thyroid stimulating hormone, which is kind of like the main test, the main blood test that they would do. And if the numbers are really off on it, then a physician would know, okay, we've got some thyroid, you know, going on. And it can be either hypo or hyper. It is kind of complicated. You don't always have a whole lot of information just in that one TSH test. And so a lot of times you need to dig deeper. You need to test for antibodies. You need to test your T3 and your T4, which are, those are, I guess, sort of like different thyroid, different things that your thyroid produces. And if you have thyroid issues, you can take like T3 or T4. Like sometimes they're synthetic and sometimes they, I think they do what's called glandulars, which they like grind up the thyroid gland from, say, like a pig or whatever, and you know, you can get those thyroid hormones that way. But anyway, thankfully I've never had a TSH test come back abnormal. So I'm assuming I don't have Hashimoto's, because honestly, I'm really thankful, because my goodness, it's kind of enough to just have ulcerative colitis and dry eye and possibly Sjogren's. But I discovered this Facebook group probably, maybe 7 or 8 years ago. And I was just learning. I was learning a lot. I don't always look on there too much anymore. But there was a time where I was really following the posts, and there's a lot of good education and everything. And, you know, they're not necessarily giving medical advice or anything like that, but it's just a place of community and a place to learn. And so I guess a number of people, you know, talked about this low-dose naltrexone and how it helped them in their thyroid autoimmune journey and helped their symptoms and whatever. And so I learned about that, you know, it's a medicine that's typically compounded. It's a medicine that a lot of doctors, just kind of mainstream physicians, don't either really know about or won't prescribe. And here's kind of the interesting thing about it, y'all. And I mean, this is not me being cynical, but they don't typically prescribe it, I think, because they don't make any money off of it. And that's not to say that doctors are bad people or that they're money hungry or anything, but goodness, I mean, practicing medicine is a business, right? It's how these physicians pay their bills. It's how they send their kids to school and put their kids through college and pay a mortgage and all of that. So, but the low dose naltrexone is a very low cost drug. And yes, it does have to be compounded at a knowledgeable compounding pharmacy that, you know, knows what they're doing. But as far as cost, I did some math about like how much I pay and what the price per capsule is. And it came out to about $1.10. And so in the scheme of things, it's really not that bad. Now, it's gone up a little over the past several years. When I first started taking it, it was probably more like 90 or 95 cents a capsule. But in everything, costs have gone up. So I have mine compounded from a pharmacy that's in Florida, and then they ship it to me. I will usually get a 90-day supply. That's, you know, that's really convenient because you just call, 4 times a year, every 3 months. So yeah. And then say, hey, I need a refill. And the prescription is on file. Usually my doctor will call in a year's worth of refills. And that pharmacy has my prescription on file. And all I have to do is either call in or go online, request a refill. And then they ship it to me. And so I take the medicine at night, and that's part of how it works. So if you want to do a deep dive, please go on that website, the ldnresearchtrust.org. And there may be even some other videos out there, like say on YouTube or whatever about it. But the best way that I can kind of explain it to you is that it inhibits your sort of like endorphin receptors. It's something to do with your endorphin receptors. And so you take it before you go to bed, and then it blocks all of that. So like it blocks the production of endorphins, and I guess blocks the release of endorphins for about 3 or 4 hours while you're sleeping. And then after that wears off, you get this flood of endorphins. And so all that kind of comes back online, and your endorphins are flooding your system. And the action of that night after night after night will begin, hopefully, if it works for you, to upregulate your immune system. And then, you know, as your immune system is working better, then it can kind of calm down, say, for example, maybe inflammatory cytokines, which are, you know, inflammatory cells, and just various things. So for me, I started taking LDN, I believe it was the summer of 2018. And thankfully, I was able to find a doctor in our area who was knowledgeable about it and prescribed it. He had been, I guess, educated about it in his residency. He had a lot of his patients on it who, you know, were kind of like me, who had an inflammatory condition, some type of autoimmune condition. And so I was really, really thankful to be able to find him. That's probably one of the biggest hurdles, in my opinion, is just finding a practitioner in your area who knows about it and who's willing to prescribe it to you. And actually, I don't see him anymore, and it's nothing against him. I would love to still see that original doctor who prescribed it to me, but he ended up going in a more specialized clinic, and you have to have a certain kind of insurance, health insurance, to see him. And we don't have that brand of health insurance anymore. So, and that wasn't the case when I originally saw him, but he has shifted over to this other clinic. And so one of his colleagues, thankfully, who had worked with him, I guess, in that original clinic, I ended up switching to him, as my general practitioner, and he's the one that prescribes it for me now. And so I am really, really thankful. But it has helped me so much when I got on that medicine. And you talk, I mean, I've talked about this before, but you start at an even lower dose. I think it's usually, the starter dose is like 1.5 milligrams. And so you take that for a month, then you go up to 3 milligrams and you do that for a month. And then you get up to the 4.5, and that is for most people going to be their therapeutic dose. I have heard of other people taking a little bit higher dose than that, like maybe a 6 milligram or 9 milligram. I don't think I've ever heard of anybody being on over 9 or 10 milligrams. But for whatever reason, that extremely low dose helps your body with all of that upregulation of the immune system. And that has been the case for me. Now, it took a while. You've got to be patient with it. That first month, there was very little shift. I mean, there was maybe just the most minute shift. And I will say that I was somewhat flared still when I started on that medication. I had made a lot of progress. I had been, in the hospital, I guess that previous summer, at the end of that summer of 2017. And over the course of that year, and I've talked about this, I did a lot of juicing and juiced every day, and that helped my gut heal and helped me get a lot of good nutrition. But I was still on a small dose of the prednisone. And I don't remember exactly, but it was probably 5 or maybe 10 milligrams. And I could not seem to come off that. You would think once you get down that far that it would just be a cakewalk to just leave it behind. But a lot of times, and this is pretty typical. I mean, I've heard physicians talk about this. It's even when your body gets down to that small dose, it just doesn't want to let go. And so that was the case for me. I don't think I was able to get off that low dose of the steroid for another probably 3 or 4 months, something like that. But eventually, yes, I was able to go ahead and come off it, which was such a blessing because I had been tapering down on prednisone from about, I think they sent me home from the hospital on 40 or 50 milligrams. And I had been tapering slowly that entire year. So to be able to then finally get off of it, wow, that was really a blessing. Because as we've discussed, I was eventually able to taper off of those. And that was a great thing. But I don't think I would have been able to do it, honestly, y'all, if I hadn't started on that LDN. Now, is it going to work for everybody? Maybe not. But I did find that the sort of further on my journey that I got with it, the better and better that I felt and the better my health became. It's kind of just this slow and steady process. It's just that night after night of consistently taking the medicine. So if you start on it and you feel like maybe you're not making any headway, I would say just give it some time. Like, I wouldn't make a big judgment call on it for at least 6 months. And honestly, y'all, the longer I've been on it, it just has kind of like helped me more and more and more. You know, it's been a really good thing. And here's one of the best things about it is that not only is it low cost, but there are virtually no side effects. So there are maybe a couple of small side effects. And well, what are those? One is that it can disrupt your sleep slightly. And that happens, we've talked about how when that endorphin production and that release, you know, kind of happens after the medicine wears off after about 3 or 4 hours, then sometimes when all that's just kind of flooding out, it can cause you to wake up. It also can cause you to have kind of vivid dreams. And I had a little of that at first, and I had a little bit of that waking up thing. But honestly, in the scheme of things, that is not really a big deal. I found, at least. It certainly was not any kind of a reason not to take that medicine. And as far as I know, those are the only side effects. Now, again, like I've said, none of this is medical advice. Do your own research. Talk with your doctor. See if it might be an option for you, if it sounds interesting. But I'm super thankful for it. That's about low-dose naltrexone, and it's just, like I said, something that it's becoming more and more well-known. It's becoming more and more discussed in I guess kind of medical circles, and more doctors are maybe hearing about it or choosing to use it. It may be something that you know you'd have to ask about, and honestly, you got to have kind of the right kind of doctor who's going to want to prescribe it, and not to be cynical, but again, they're not going to make any money off of it. So if they are very genuine and kind, and they genuinely want you to get better, they'd probably be willing to. And if they just want to prescribe medications, you know, that they get paid to prescribe, you know, if there's some monetary incentive, then they might not be as open. But anyway, I think that's about all. And thanks for watching. Please like and subscribe. See you later. Bye.